Hi, all. This is Debbie McGlasson. I'm just going to go over my week 6 clinical soap note. Had a patient who was 82 years old, came into the clinic complaining of knee pain for about 2 months or so. Um, Patient's initials are PO. PO is an 82-year-old Caucasian female who actually is well known to the practice. She came in the clinic because she was having left knee pain for approximately 2 months. According to the patient, she said she had had no injury or trauma to the knee, and it just had progressively gotten worse over the last 2 months when she was standing for extended periods of time, or she likes to garden, so anytime she was gardening for long periods outside in the garden, she would start having ongoing pain. She said she was previously consuming Tylenol, and that seemed to be working. But over the past couple of weeks, she said that the Tylenol was no longer cutting it. PO has a history of depression, and that's being well controlled with fluoxetine 20 milligrams daily. She doesn't smoke, denies any alcohol or illegal drug usage, and her last visit to the clinic was in March of 2019. Last mammogram, pap smear was 8 years ago. She had um, her last pap smear, was about 20 years ago. She had a hysterectomy back in 1997. The only meds that she is taking now currently is the fluoxetine, and takes that 20 milligrams in the morning, and she takes 2 tabs, 325 Tylenol PRN for the knee pain. Her past medical history: she has a history of depression. She's had no recent hospitalizations, and like I said, she had a hysterectomy back in 1997. She has no allergies to food or medications. As far as her review of symptoms, she states that she feels well, other than having pain to that left knee that has become more noticeable over the last 2 months. At the time of the visit, her pain was 4 out of 10. Again, she denied any injury or trauma to the knee or to the leg recently. Other than her eyes, ears, nose, throat, respiratory, cardiac, abdominal, GI, GU, endocrine, um, integumentary, neurological, were all unremarkable. She denies any numbness or tingling to any extremity or that particular left extremity. As far as musculoskeletal, she was positive for weakness to that left knee, but she denies any locking, popping, stiffness, injury, or recent trauma to the area again. Psychiatric, she states that she's had no increased depression. She denies any anxiety, suicide, or homicidal thoughts, and any mood changes. She said that despite having the knee pain, she sleeps well, and she denies any mood or diet changes. She also denies any bruising or bleeding or any noticing any swollen lymph nodes. She hadn't had any lab work since December of 2018, which at that time was unremarkable. We did go ahead and do an x-ray of the left lower extremity in-house. It revealed no fractures, and that was on 10/8. Her vital signs: blood pressure was 112/66, heart rate was 70, respiration's 18, temp is 98.8. She's 98% on room air. She's 5'6", currently 174 pounds. Her previous weight was 178 pounds. And her BMI is 28.08. As far as her exam, HENT was unremarkable. Respiratory, unremarkable. Cardiac, normal, unremarkable. Musculoskeletal. She didn't have any ecchymosis or any erythema to the left lower extremity or that knee area that was noted. She had no joint effusions, no instability or edema to the left patella or the leg noted. She did have slight pain with palpitation of that left knee. She had normal full range of motion to all extremities. Flexion and extension was within normal limits to all of her extremities. Popliteal pulses and all pulses were +2 bilaterally. There was no popping or locking with movement to the left extremity noted. She had normal strength and tone to the bilateral lower extremities. No numbness or tingling to the left lower extremity. Sensation was normal bilaterally. Her gait was normal. Straight leg lift bilaterally was greater than 80%. Her patella instability test was negative. So what we said was that she presented today with pain to the left knee, which had become more bothersome over the last 2 months. The patient's overall physical exam was unremarkable. Lungs are clear to auscultation. There's no respiratory distress, stridor, or abnormal lung sounds noted. No abnormal heart sounds. We did note that there was some tenderness noted to the left knee upon palpation. However, there are no deficits with range of motion, flexion, or extension that was noted. She again denies any popping or locking, numbness, or tingling to the left lower extremity. Popliteal and pedal pulses are normal bilaterally. There was no trauma to the area. So we kind of found it highly unlikely that there was a fracture or any meniscal tear or any effusion to that knee or to that leg. However, based on Otto's rules, this patient, due to her age, she warranted radiological testing. So in the office, like I said, we did a left lower extremity x-ray, which proved to show no fractures or abnormalities. We also ordered a CBC, a BMP, and an ESR to rule out any infectious or inflammatory processes. Based on the patient's presentation, her history, her age, physical exam, and negative x-ray findings, we thought that the cause of the patient's pain is an exacerbation of some undiagnosed osteoarthritis to that left knee. We recommended initiating physical therapy for muscle strengthening to that extremity, as well as starting the patient on ibuprofen 600 milligrams TID for 2 weeks for the increased pain, and then follow up in the office for an evaluation. Some of the differentials that we came up with were potential patellofemoral pain syndrome, and that was related to the insidious onset of left knee pain without any etiology. Arthritis related to the patient's age and the chronic nature of her pain, that it had been progressive over the last 2 months. She could possibly have arthritis due to her age. Degenerative meniscal tear related to the insidious onset without any trauma or pain. However, due to her patella, it's highly unlikely that she had a meniscal tear, being that there was no instability and her patella test was negative. And then chronic pain syndrome, only thought of that because patient had pain that was lasting for greater than 6 weeks without any kind of known origin. But we really thought it was osteoarthritis because the patient, it happens only when she is on that knee for a long period of time in the same position. It does get better with movement. So we kind of thought that it was the osteoarthritis of that knee. Um, Thank you guys. I hope you enjoyed this video, and I will be seeing you later in class. Thank you.